Thanks. Minister, I move Amendment 5, and I'm going to speak to Amendment 5 and Amendment 6 because they're the same, and I don't want to tick-tacking back and forth here on the same set of amendments. So, Minister, Amendment 5 and Amendment 6 I have tabled for to do with the issue of long COVID, and I spoke about this at length during second stage of the bill. And I want to see long COVID designated as an occupational illness for all frontline workers who contracted the virus due to their employment. And what needs to happen is, Minister, we need to see long COVID being listed as an occupational illness, allowing frontline workers to avail of long-term income assistance until they're actually fit to return to work. Now, at present, only healthcare workers who were out sick prior to the 15th of November 2021, which was prior to the Omicron variant of SARS-CoV-2 being detected, are able to avail of paid leave, which will cease in June of next year, if they've not made a recovery that allows them to return to work within that period. And they're only public sector workers who contracted the virus prior to the 15th of November of last year. All other frontline workers, including healthcare workers out sick due to long COVID, contracted as a result of picking up the virus in work, are now excluded from any support through their employer. And this applies to any frontline worker outside of the public service who contracted long COVID as a result of their employment, as they are also excluded from the occupational illness schemes. Now, Minister, across Europe, I understand from a Eurostat survey that was carried out last year, the only two member states of the European Union that have categorically ruled out making provision for long COVID as an occupational illness are ourselves and Greece. I know that in Denmark, in Italy, in Latvia and Slovenia, they have put specific provisions in place. I know other countries such as Norway and Israel have also done that. And it's acknowledging the fact that people who contracted the virus and subsequently ended up with long COVID, who were in frontline people-facing jobs during the pandemic, are getting support. We ask them to roll up their sleeves. We ask them to go in and run our hospitals, run our supermarkets, support people with disabilities. And we're talking about a very small cohort of people as a proportion of all of those that contracted the virus. But we're now turning our backs on those particular individuals. And I don't think it's fair, Minister. I don't think it's right. Now, I know that healthcare workers who have taken this up with Minister Donnelly, and Minister Donnelly has come back in correspondence advising that officials from the Department of Social Protection who operate the National Occupational Injuries Benefit Scheme have said that COVID-19 does not constitute a prescribed disease or illness as set out in the Social Welfare Consolidation Act, and we're aware of that, but that they have no intention of actually revising this position. And as I say, Minister, that's not good enough. And if we take just the healthcare workers alone, you know, an arbitrary date of being out of work for 84 days prior to the 7th of February 2022 has been picked. And I've asked, well, what's the basis for the 7th of February date being picked? What's the basis for the 84 days prior to that, to the 11th of November of 2021? There is no basis for it. These dates have literally been plucked out of the sky. We're excluding everyone that contracted the virus as the Omicron strain of the virus, which was the most contagious strain of the virus. And we're saying, absolutely, you're completely excluded from any support, even if you were a healthcare worker. And as I say, other frontline workers are also being excluded. Now, long COVID is costing at least €500 million in lost work and welfare alone. And your own data, Minister, that you have provided to me has shown that 0.81% of all those who contracted COVID-19, who claimed enhanced illness benefit, were still out of work 12 weeks later. And as I've said, if that was extrapolated across our population, it would equate to €586 million in lost welfare and wages. And you know, some of these workers, and I gave an example here the last day, some of these workers have had, healthcare workers, have gone to huge financial cost themselves in trying to manage this illness. And I gave you an example of one young woman, one young fit woman, a specialist clinical physiotherapist, who has gone to a whole plethora of private clinics, paid for herself, has a monthly bill now for medication of €270, which is not covered under the GMS, is not covered under the drug refund scheme, and she is getting absolutely zilch from the state whatsoever, even though she went in, she worked right the way through the pandemic, and because she ended up with the Omicron strain of the virus and subsequently ended up with long COVID, she is being ignored. And there are hundreds more around the country in a similar situation. So I'm asking you, Minister, to give serious consideration to acknowledging that long COVID is debilitating. It is, in a certain number of employments, in all probability, having been developed as a result of picking up the infection through that employment. And those people need to be acknowledged by the welfare system. And I'd really ask you to consider these amendments. Thank you.
Thank you, Cathaoirleach, and thank you, Deputy Naughten, for raising this. I'd just like to talk, like you did yourself, with the next two amendments together. Look, the first amendment, you know, I'm not prepared to accept it, and I'll explain shortly, but I am prepared to do a report. I'm happy to do a report. My department is monitoring the work and the recommendations of the European Commission in this regard, and I understand that the Commission has published their recommendations on occupational diseases this very week. And I can just assure the deputies that my department and the other government bodies concerned will give very careful consideration to the Commission recommendation. I haven't seen it myself. And the proposed amendment regarding including the medical examination of virological and bacteriological. I know that's what you wanted to include in it, but I'm happy to consider that in the context of the report. So the report, of course, will require consultation with the stakeholders, the Department of Health, the Health and Safety Authority, following consideration of the EU Commission's recommendations, and I am not adverse to arranging for such a report to be inducted. In fact, I can assure you here I will do it. However, the Chief Medical Officer of my department has warned that because COVID-19 was so widespread, adding long COVID as an occupational illness in the statute book could be difficult. But look, we're happy to look at it here, I think conducting a report on this important issue is timely, and I'm happy to do that. So, as part of that report, then I will look specifically at your proposal, I'm happy to see what we can do at that stage. If we change the legislation before we do if we change this legislation here tonight, or before we do the report, then that sort of would be putting the cart before the horse. So, as I said, I'm happy to do the report and take into consideration the proposed amendment that you're asking for here. And I will talk to the Minister for Health. I will talk to the Chief Medical Officer. So, thanks.
Thank you for your response. Look, I would love if we had a situation where we could amend the legislation. We can't propose that, as you know. You are meeting me halfway, and I want to acknowledge that in relation to it. I accept that this is not a black and white situation. COVID as an illness was widespread across this country. However, the point I'm making is, Minister, that in all probability, the vast majority of those frontline workers contracted that virus through their employment. And we have that in the past, where on the basis of probability, the state has paid out in terms of medical conditions previously. So there is a precedent there for that. And the final point I make to you as Minister, this was adopted unanimously by the House at the start of this month when we brought forward our proposal. One was that healthcare workers would get proper provision both now and beyond June of 2023, and secondly, that there would be provision made in the occupational illness scheme. But on the basis of the response that you've given me here, I am prepared to withdraw both amendments, and we'll see what you come back with. Thank you.
That's fine. I thank the Deputy for that.
Thanks, Minister.